Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine's Longevity Channel, and today I want to talk about arm numbness or hand tingling, any kind of nerve pain or numbness that is going from the neck to the hand. I get a lot of questions about this. I think conventional medicine definitely has some interesting therapies for some of these issues, but also falls short in many ways when it comes to numbness and tingling and nerve pain. How they test it can be painful, and what they do about it can be aggressive. So it's important to try some other alternatives prior to going the conventional medical route when you have numbness and tingling in your hands or in your arms, because it could be fixed by many different alternative treatments prior to needing a nerve conduction test and surgery, which is usually, depending on what it is that you have, usually what they recommend. So the first thing that I want to address is something called TOS, which is called thoracic outlet syndrome. And that means that, your brachial plexus, which is the nerves coming from your neck, from your spinal cord down through here and then into your hands, like that's how all your nerves get down to your hands, right? We kind of all know that. But there's a huge amount of nerve networking right here, which is called the brachial plexus, where it almost looks like a bunch of wires that are crisscrossing, ultimately leading to your hands with the ulnar nerve, which is these fingers, and then the radial nerve, which is your thumb and a couple of these fingers. And so different things can happen from the neck down to the hands regarding these nerves. And thoracic outlet syndrome is when this area, the brachial plexus, is compressed. And that can cause numbness in both hands. Sometimes it's just as simple as causing that numbness when you're sleeping incorrectly and it wakes you up at night. Sometimes numbness can happen throughout the day, when you're doing certain things, or maybe you have done something the day before that aggravated the tension here. And that happens because of tension. So that happens because of trapezius tension, which is this massive muscle here, and other types of neck tension and shoulder tension in the muscle itself, not necessarily a joint, right? We talk a lot about joint pain, but this particular situation is caused by muscle tension. Physical therapy is a great place to start, as well as chiropractic, massage, and acupuncture. And trigger point therapy. So the thing that will fix it the most out of all of those alternative therapies, which you could choose any one of or a combination of, is trigger point injection therapy. And that's an intramuscular injection that releases the muscles right away. And I see people get results with thoracic outlet syndrome or improvements from thoracic outlet syndrome immediately afterwards, like one treatment. It usually takes multiple treatments in order to get the thing to go away completely, but they experience improvement right away. And acupuncture is the next therapy I would probably choose. So if for some reason you can't afford to do trigger point therapy, or you don't know anyone who's doing trigger point injection therapy, check out acupuncture, because usually a solid acupuncturist can get rid of that in a few treatments as well, and insurance covers that, and it's widely available to many people. Physical therapy will help you learn how to make sure that that tension doesn't repeat itself. So once it's been released by trigger point injection therapy or acupuncture, learning different exercises to keep your shoulders down, to keep your chest open, to make sure that you don't end up with that issue again is really important. There's neck exercises that you can do, and a really good physical therapist will help you learn how to do that so that you don't end up with thoracic outlet syndrome anymore. So that's the first kind of quick and dirty issue. The next thing that typically happens in the hands is, numbness and tingling down the arm. That can happen from arthritis in the neck. Sometimes when arthritis happens in the neck, the joint has slippage. So the facets, your neck can slip a little bit forward, or it can slip a little bit backward, typically more forward in the neck because of the curvature that it has. The places, the little holes, the foramen that the nerves come out of can start to become smaller, irritating the nerve roots. That can cause tingling down the arms. Acupuncture is very effective in treating these things as well, along with a few other internal medicine and supplements. And then the next condition is ulnar nerve entrapment syndrome. There's also a medial nerve entrapment syndrome, although less common and more signified as carpal tunnel. But the ulnar nerve entrapment syndrome is, let's see if you can see it here. The ulnar nerve travels through here. It's a big nerve, and the muscles of the forearm can get very tight, and triceps can also get very tight. And this happens very often in tradespeople, auto mechanics, electrician, anyone who's like screwing a lot of things or using their hands a lot for their trade. Ulnar nerve entrapment syndrome can happen pretty often in these people. It should be one-sided if it's both sides. Most likely there's an internal medical issue of inflammation going on. And so if you're getting this finger is numb and this finger is numb and half of this finger is numb, then that's a good indication that you have ulnar nerve entrapment syndrome. And massage, PT, and trigger point injection therapies can release all of that as well. So there's really, there is a surgical release of the ulnar nerve, wildly unnecessary as long as it's being caught within reason, like early, because the longer that nerve is entrapped, the longer it cannot send the information it needs to send to the tips of the fingers and the hand, getting circulation and nutrients and all these things in that direction. And so as soon as you start to feel that numbness and tingling, it's important to differentiate, is it coming from the neck or is it coming from the ulnar nerve entrapment right here, right, in your elbow or forearm. So that's another thing. So thoracic outlet syndrome treated by trigger point injection therapy, ulnar nerve entrapment syndrome also treated by trigger point injection therapy, acupuncture, and PT. The neck, if you have arthritic issues in your neck, it would be great to seek out a chiropractor. The combination of chiropractic, trigger point injections, and acupuncture for arthritic necks can be very successful for people, and there really aren't any other therapies out there that can get these people out of pain other than taking over-the-counter medication, which destroys the liver and the digestive tract. Do not kid yourself. If you're taking over-the-counter pain medication regularly, you are doing a lot of harm to a lot of internal systems that you won't realize until much later down the road, and they will cause other issues. So if you're taking over-the-counter pain medication for arthritis or other painful issues, please seek out these alternative treatments there's no side effects. You maybe have a little post-treatment soreness, but they do not have long-term debilitating side effects, which is why it is so important for people to know that there are multiple types of treatment outside of pain management with medication and surgical options. And so the next thing that happens in the forearm, or numbness and tingling in the forearms and hands, is carpal tunnel syndrome. And there, as many of you probably have heard or know about, they release the tendon here. It's a sheath, really, that the median nerve travels through. And that creates more space for the median nerve, which is what is getting entrapped or squished with carpal tunnel syndrome and causing the numbness and tingling in the hands. And there are also, again, so many things to be done before surgery needs to be done, including acupuncture therapy, trigger point injections, PT, and you guessed it, chiropractic. So all of these alternative therapies, definitely chiropractic and acupuncture, widely well known and insurance pays for. Trigger point injections help release those muscles, and there's a few different other types of Chinese techniques that can also help release the tendons in the arm that create more space for the median nerve and getting rid of carpal tunnel syndrome. Lastly, and usually I lead with this, there are some internal medical issues that can be related to, numbness and tingling in the hands and through the arms that need to be addressed, before any of these other more dramatic measures are taken. And they will pop up elsewhere. Like, let's say you have carpal tunnel syndrome, but you're pre-diabetic And nobody found that because you went to get this carpal tunnel situation taken care of, not realizing that blood sugar could be affecting those nerves, and that if you would get your blood sugar under control and reverse your type 2 diabetes, that carpal tunnel syndrome either would bother you 90% less or not at all. And so it's really important to not overlook these things when we're having painful conditions, and make sure that you get the proper screening so that you get diagnosed correctly and don't unnecessarily end up a surgery candidate. And so really important for nerves, they do not appreciate imbalanced blood sugars. So it's really, really important to double check that you're not pre-diabetic, diabetic, or have elevated triglyceride levels. That also can cause numbness and tingling. This can happen in the legs and feet too, but we will go over that on a different day. And then the other thing I'll say is people who are B12, folic acid, and B6 deficient typically have more paresthesias, meaning numbness on the skin, or numbness and tingling down the arms and down the legs and hands and feet. So those are the two internal medical things that need to be looked at, is micronutrient deficiencies, especially B vitamins, B12, B6, and folic acid, and are your blood sugars or triglycerides imbalanced? And having that assessed by a naturopathic doctor is really important, because a conventional medical doctor is not really going to address those things or think that they are as connected as they are to the nerve issues that you are experiencing. So that's all for today, guys. Just kind of wanted to talk about this because I get a lot of questions about it and a lot of surprised looks when I start to talk about all the different things that this could be. I think they get oversimplified, and there aren't a lot of options, like I said, out in the conventional medical model. And so it's really important they're treated correctly so they don't come back. And that's the whole goal, right? Is get the thing taken care of, understand where it's coming from, and treat that so that you don't have to deal with this issue anymore. If you know anyone who could use this video or is experiencing numbness and tingling in their arms or pain in their neck, shoulders, arms, that sort of thing, then please share this video with them so that they can get the treatment and the care that they need. Thanks for watching. Please like, subscribe, and share.